great show. It seems like everything is surrounding COVID-19, but this is our life. And today we're going to have a great show and talk about something that's very near and dear to our hearts. So again, thank you everyone for being here. As I always do, I'm just going to do a little premise of what this show is about. Our audience has been growing rapidly for the 16 months that we've been on. And for the people that are on today for the first time, let me tell you what 62 Who Knew is all about. My father, when he turned 62, and his father, when he turned 62, all had the same questions. Have I saved enough money? Should the house be free and clear? Do I need life insurance? Do I need long-term care insurance? Should I have already bought it? Should I cancel my life insurance? Should I be investing in the stock market or annuities? Should I keep working? Should I take my Social Security or should I defer it to later years and get a higher check? Those questions and many, many more have been questions that people ask in their upper 50s, right to that magic number of 62, because although not everyone is retiring at 62, most people are not in today's world, that's when retirement is heavy on all our minds. We've all got those same questions. Our father, their father. But the truth of the matter is, my generation, I just turned 62, about 7 weeks ago. I had to look at the calendar. And my generation, people in their 50s right now, low 60s, they have one other hurdle. They have one obstacle that is not like our fathers and their fathers before them. And what is that obstacle? It is the mixed blessing, or if you wish, the double-edged sword of longer lifespans. Unbelievable that longer lifespans could cause issues, but they have. Scientific breakthroughs, medical advanced technologies over the last 3 decades have basically brought the majority of people who make it into their 60s into their 90s. That's incredible when you think about it. Who knew at 62 that you could still have 30 years left? Who knew at 62 that you could have half the time left that you've already been here? And the truth is, less than 1% of this great country has the financial capability to live 30 years through retirement with a high level and a high quality of life. And that's why we have this program. And I think that's why it's grown so rapidly and been accepted so much by the general public. Every week we endeavor to bring on different experts that deal in Medicare supplemental policies, long-term care insurance, in-home care, which we're bringing on a national expert today, savings, vacations, health, population, national real estate experts to talk about senior housing. It really doesn't stop. And of course, now COVID-19 has given us all a common thread and how that has changed our lives. But that's what 62 Who Knew is about, to help you, our ever-growing audience, go from 62 to 90 or 95 with a high quality of life. So welcome to my viewers that have been growing with us, and welcome to any new viewers. But without further ado, this is one of our favorite guests. He has been with us several times before. We haven't had him in a few months, but I'm sure he has been busy. And as the regional director of Home Instead, the Home Instead in-home care, the largest non-medical in-home care in the United States of America, I am absolutely sure his last 5 months has been more chaotic than mine, and mine's been pretty chaotic. So welcome back, Mr. Colin Castle, and we're so glad to have him. How are you, sir? Oh, I'm not hearing Colin right now. Nope, not hearing you, Colin. This is how bad COVID-19 is. He's hearing me. I can not hearing him. That's interesting. I was hearing him before. Colin, you're hearing me, aren't you? Do you know sign language? That I know one other sign, but the viewers wouldn't like it.
How's that? Is that working?
That is better. Right. Now we have them.
So I get for trying to be smart. My IT side of me, I tried to put you on the speaker so I could hear you better in stereo instead of mono. And
that's okay.
Turned off my mic, so now I got to hear you in mono and probably talk in mono too.
We got you, so that's all that counts. So first and foremost, before we talk about COVID-19 and in-home care, how are you, your wife, your wonderful children doing? This has been rough. And you have a lot of children. You're not the average 2.3 children people.
No, my wife and I have a little bit more than the average 2.3. It might be doubled that, if not maybe even triple.
Triple, yeah.
So I'd have to say our experience is we've experienced it all, from attempting to run a business during the COVID and the shutdown, to homeschooling, as well for our 13-year-old, our two small ones that are in kindergarten and first grade. Luckily, we were essential workers, so our two small ones go to daycare, and then we transition into summer months and trying to find camps that are open instead of having all four kids at home at one time. And that's just the littles, the 4 under the age of 6 at home at one time versus the 13-year-old. Then we started back to school. So yeah, it's been say the least an interesting 5 months now.
Yeah, it really has. It's unbelievable. Who would have thought in the beginning of 2020, life is good, rates are low, houses are selling, Wall Street's made a comeback. We knew we were in for a maniac presidential election, because they're all maniac presidential elections the last 20 years. But who would have thought 3 months later we'd be walking around with masks and literally closing down, the most vigorous capitalistic system known to mankind. And that's what we did. We literally closed it down.
We did. And here, we all are being here in Central Florida. We're very hospitality-driven, service-driven industry here in Florida. So I know of a number of folks that are hit pretty hard by this, and especially in the restaurant and service industry, it's tough for some folks that I've known and have grown up with. That's all they've known and all they've done. Carved out a good life for them, but now that their main lifeblood is really gone, at least for the foreseeable future, it's tough. So I do feel for them.
I went 3 months without seeing my grandchildren. We FaceTimed. They were all local, and I'm used to seeing them 3, 4, 5 times a week. At the end of 3 months, I just said I have some risk factors. My heart's fine. I need a body transplant. I got some real risk factors here. But without going into them, after 3 months, I said, you know what? I'll wear a mask, but I got to give my grandkids a hug. And I know a lot of people felt like that. And the doctor said I shouldn't, but I did. And to this day, I'm visiting my daughter's house, who's very, very careful, but I can't not see my grandchildren. After 3 months, it was driving me crazy. It really was. And but let's talk about some real stuff here. First, let's talk about how many of your great people, your healthcare providers, your people that go into homes, how were they affected when this all first started? Did a percentage of them say, look, I don't think I can go into older people's houses? Or did you have some company policy on that? How did you treat it at home instead?
Well, locally here in our neck of the woods, we had a pretty good, number of people just were scared. So we had I'd probably say a good, 1 out of 6 decided to take a leave of absence initially, just either they had a spouse that might be, immune compromised or themselves immune compromised, or when the school shut down, that they, had children at home and they couldn't work. But that lasted for a short period of time, and then people will start to want to go back to work. Because again, our business is very personal. It isn't just a job. People realize that if they don't see their senior, there's life events that aren't occurring And we can get into great detail, but if most people can understand the major body functions, eating and others, those all still occur. And a lot of folks are very personal, and they want to make sure that their senior that they've cared for be it just a week or years is well taken care of. So, they came back, and we've had to put together some, fit for duty type tests like a lot of folks do. And we've had to change our precautions and, lock down the building, and really take a lot of precautions. But, we dipped a little bit the first month, but we've rebounded up from that, especially as unfortunately, the COVID situation around the facilities here locally, really took a big turn when we had a few facilities have a large population of positive cases, and then ultimately, they ended in death as well. Mm-hmm. So that, unfortunately put Florida, not like we need any extra reasons to be on the headline, put us back in the headlines again, for things like that. So it's been a roller coaster ride, to say the least, with that.
Did many of your people, your associates, ever test positive, or did any have a rough time, or God forbid, did any die?
We did have one caregiver that it was a great person, heart in the right place. She took care of folks at her church. She had a lot of individuals she took care of outside of our world that ended up contracting it and passed away from it. So she's going to be, outside of being an employee of ours, she'll be solely missed at her church and her community level. She was just that type of person that just gave the shirt off her back for anybody. Other than that, not to diminish that huge issue right there, is we had a few people that just did some self-quarantine because either a family member tested positive and they had to self-quarantine, or they were exposed, be it at a facility or another job that they had to self-quarantine, or a client of ours, turned to be positive and they had to self-quarantine. So we had a little bit of a balancing act of some roller coaster rides with those. But again, we didn't really have anyone of those cases turn positive and into anything too terrible. One is enough in my book. One was too many to begin with.
Now that's on the employee side. Now, how about on your client side? Did your great people have to see more pain and suffering than they normally do the last 5 months?
Luckily, no, we didn't have any directly with us. But, we do take care of a lot of seniors throughout our county area. And, they've had exposure to, the bad side of this disease elsewhere, be it in other communities they work with or other home care agencies they may work with. The hard part, I think everyone realized in our industry is, as much as I would love to have, a block of caregivers that just work for us and only have one client, the reality is this is a caregiver-driven industry, and caregivers sort of pick and choose, and they can work for 2-3 agencies plus a nursing home at times, depending on the workload and shifts. So they do unfortunately get a lot of exposure, good and bad, to COVID, but they also get exposure to what's going on out in the community as well. So luckily for us, client-wise, no one, really contracted, was sick or passed away. But we did have a number of clients that just had to self-quarantine or went on hold just simply because they were going to self-isolate out of abundance of precaution. But at some point in time,
you definitely have to err on the side of caution. There's no doubt.
Yeah. Unfortunately, on that one side of abundance of precaution turned into, another issue. They weren't getting services they need. So then they had to have the balancing act of where do I start care again? Because I have to have it, but when?
Yeah, exactly. Well, and there's always that question, and I want to talk to you about this too. Should mom and dad go to the care facility? And, a lot of times, people think children are making that decision, But I know here in the reverse mortgage, my reverse mortgage world, sometimes it's not the children. Sometimes, in fact, I have to say most times, mom and dad are quite coherent, quite strong, and they make the damn decision. In fact, I've actually had seniors say to me, "Why are you asking my children's opinion? I don't tell them where to live." And I love that, from our seniors. But, there always is that question, whether it's from the children or the actual senior. Am I better off in the facility, or am I better off at home with a little in-home care when I need it, checking my meds, checking my vitals, helping me shop? Do I need to be there? And I think that question is going to be asked a lot more seriously post-COVID-19 than ever before, because let's face it, those care facilities, and I know they all tried hard, they were incubators. They were little death prisons. I hate to say that because I know no one did that on purpose, but the great majority of deaths came inside care facilities. That gives me the chills.
Yeah, it's. And I know a number of administrators, and I've talked to a number of them here locally. And you're right. They've tried. They've had a massive hurdle from funding to PPE gear. We had a massive shortage here in Florida for a long time. If you weren't a hospital, you weren't getting it until, a number of groups kind of helped out with it. But even then, when you got it, you were paying, $1.50 to $2 for a disposable mask. If you wanted a KN95 mask, the first batch we bought, where we bought 2,000, we paid $4.25 per mask. So that's, almost 4 times its normal rate,
Shouldn't that have been against the law? Isn't that gouging?
Some usury laws in there. Yeah, there should be something, price gouging, something. But it is what it is. That's who's supply and demand at the time. They couldn't get it, and to get it here was shipping and things of that nature. So that was a huge issue. So I know they had some challenges with it. But, I think we also have to look at, again, I can only speak for me, here locally, is a lot of the nursing homes that we have are Medicaid nursing homes. So the reality for those individuals, they weren't going anywhere. I mean, unfortunately, they just had to batten down the hatches and go. But we did see what we did see from our perspective is we did have a large exodus of clients that would go to the rehab, skipped rehab, and went straight home with that. So they still got sick, they still hurt themselves, but instead of going to rehab and staying in the nursing home, they would actually, come home faster and sooner with that. And then, of course, we did have a small percentage of people with the wherewithal and ability to just simply take their mom and dad, right out of the care facility and back home. So I think it was a combination of all, but a number of folks have just weathered the storm, staying in the facilities. Because a lot of people, that's where they live, that's where they know, that's the people, their friends. So they've just weathered the storm in place, if you would, want to say it that way.
Yeah, it's some storm to weather. Let's face it. For a while I was having I guess I'm giving a free plug here. What is it? Deliver It? No, not Deliver It. Anyway, I had a service bringing everything in from Publix. For a while, we had, my son to this day and daughter, even though they don't live with me, would come over, sanitize every can, everything. It's just amazing. Weathering it isn't easy. This has been weird. I mean, I think it's having an effect on the country that people are going to see forever. The lack of socialization. Again, I keep coming back to a morbid, unfortunately example, but losing somebody and not being there to hold their hand. I can't fathom the seniors that went through that and didn't have people around them that they loved. I just can't fathom it.
There's been plenty. I mean, there's been story after story that I've been privy to. I serve on a couple of associations throughout the state, and I get to hear a lot of stories with it. And there's been a number of stories, not just deaths, but just the impact of this isolation is also having a huge impact, especially with Alzheimer's patients or dementia clients. The people that are living in memory care. There's a lot of worry that once they see their loved ones again, they won't know who they are. So it's definitely been a scary thing going on right now with not being able to see your loved one. Not just the death. I think there's as bad of outcomes as death is. The fact that they may think they've been abandoned. They can't touch their loved one. They don't remember who their loved ones are anymore because they haven't visited them. It's a tragedy all the way around with it.
Yeah.
I mean, there's not outside of our world, the only, not to have any lightheartedness, but the only positiveness with some of this is this now embracement of the virtual, where,
yes,
at least grandkids and other people are starting to use some of the things. So, in a glimmer of a way, I hope it helps people at least stay connected more often than they did yesterday. If you're looking for one silver lining, I hope
that's it. And truthfully, again, we want to stick mostly to the effects of human beings. I try to do that on the show, but we are going to bring on some economic experts, because the truth of the matter is COVID-19 is going to have an effect on this economy that makes this is my opinion, it makes 2008 through 2013 may seem like a picnic. First and foremost, hundreds of thousands of people, maybe millions, got their moratorium on their 3 mortgage payments, yet there is no congressional rule or anything yet that says those 3 mortgage payments are going to go on the back of the mortgage. I don't know what's going to happen, quite frankly, if at the end of 3, and I know some people with 6-month moratoriums, if the mortgage lender goes, okay, you've enjoyed 3 months without your payment, now this month's is due, plus the 3 that you owe us. 9 out of 10, 99 out of 100 Americans, even ones that make a great living, they can't make 4 mortgage payments at a time. What is this going to do to their credit? What is it going to do to life?
Well, and I can speak to that from our caregivers' side. I don't think their income has been overly affected because we've had work, we've had, clients to serve. But, their husbands may not have had a job, or their significant others, or their kids that are living with them. So they've had other impacts that have had some pretty negative, side effects to their, not just them, but to their family unit as a whole as well. We don't know the impacts of healthcare that this is going to have. Thankfully, I'm being told that, ours as an employer, that we're going to be able to continue offering benefits. They're not going to be a major change to the benefits next year from a cost standpoint, which was a big, huge worry of mine. But thankfully, that's not going to happen. So there has been some economic, things that are occurring. And here in Florida, there is a lot of people that are unemployed, and people are thinking they're going to potentially migrate to our industry or some other industry. Well, it hasn't happened yet. So there's a lot of folks here in Florida that are just unemployed, and I'm really not sure when they're going to get back in play. But for all you listening, we do hire, and we have plenty of work. So if you need a job, you can come get one. But I do understand that it's tough. It's tough right now for everybody.
Oh, and you bring up 2 excellent points that I'd like to go to separately. Number one, we have a shortage of great healthcare people. We've talked about that before. It's not a lucrative paying job. It's a morally high paying and rewarding job. Your people are like angels. I've had experience with them. They're nothing short of angels. But is COVID-19 going to make people go, we need to do this, we need to help? Or is it going to go, I don't know if I want to go into people's houses, catch something that can infect my lungs and kill me? Is it going to hurt the future, young person that says, I want to be a healthcare worker, or is it going to help them make the decision to do it? This is a rough one.
I agree. I would say in the scheme of all healthcare, again, this is one person's opinion. I view what we do the least risky, because we can, from a caregiver standpoint, we can wear PPE gear. We don't have to worry about transitioning from one, hospital room to another room, or one room in a nursing home to another nursing home room. We don't have to worry. We just have to worry about, once we enter the home, that we protect ourselves while we're in the home, and then hopefully as well have the homeowner, respectfully, hopefully they will, abide as best they can, the social distances, or their family, while we're in the home, and let us do our work and only get close when we have to. But when we're done, we can shed that PPE gear and protect ourselves as much as we can. So for me, I view in-home actually a little bit safer than other, types of healthcare, where you have to transition from one client or patient to the next, for stars. Now, you might see 2 or 3 clients, but, like we have some caregivers, they literally have a change of clothes. That's just their way of doing things. So they'll get you done with one client, they will have another set of scrubs, they'll change, they'll have a new set of PPE gear, and they'll go through it. So we require all of our caregivers to wear, at a minimum, 3 things: gloves, mask, and goggles.
You have them wearing goggles.
Absolutely. Luckily, we started out with a face shield, but as soon as I was able to get my hands on inventory for like the 3M safety goggles that healthcare workers use, I bought a couple of pairs for every caregiver that we have, to give away. If they want to need it, it's their choice. If they have something to wear already, glasses or other safety gear, or if they want to choose a full, face shield, that's fine. But bottom line is, they had to wear all 3 of those to be in a client's home. It wasn't well received by all, but it is what it is. We have to be able to keep our caregivers safe as we can.
Yeah. I don't know. An excuse to walk around with goggles, I almost think that could almost be fun. Did you give them fins by any chance? Because that might have made the senior a little happier when you walked into their house, just as they walked in with the fins. Well, and there's so much to ask you. Bottom line, there's no doubt in my mind that your people were greatly at risk, but most certainly less at risk than being in a hospital. There's just, on a great day, a hospital, is a petri dish. You should get whatever's being, in my opinion, and I'm certainly not, a medical person, I'm a layman. If I go to the hospital, or people I love go to the hospital or care about, I think they should get whatever they're getting done and get the hell out as quick as possible. You get sick in hospitals. No insult to hospitals. But I most certainly think that somebody, that has been being careful, like I have, been in quarantine, your people are much safer. That being said, though, they were still at great risk walking into people's houses during the heart of this pandemic. And many people think there's still some bad stuff coming. Obviously, the death rate is down, but the case rate, is staggering. I remember when we passed 1,000 and politicians were going here in Florida a day. It'll never pass that. That's amazing. And then one day we passed 10,000. Do you think the worst is over? Because I am one of those people that are of the opinion, and today's it's a coincidence that all schools are opening today in Florida. I'm not sure if I had children. I do have children, but they're older. If I had school-going children, I don't think I'd be sending them.
Yeah,
what's your case on that? Since you have 27 children,
I'm a stats guy by heart. I love statistics and things of that nature. I don't know if I trust the statistics plus or minus that are out there, good or bad, with things that are going on. What I do know is I think we all should respect each other. Because I read an obituary online that a widow was very bitter to the way people treated and didn't have as much self-respect for her husband's life as they do for their own rights to choose to wear a mask or not wear a mask. I'm a big liberty guy. You know, what you do is what you do. I respect that. But I do have to look at this and go, at what point in time is your life more important than my liberty? Would a slight inconvenience for me be okay to save your life? And I think that's kind of what has shown through all this is, you know, a little bit of concern for our humanity, not to look at it that way. But I'm glad we do partake in the industry we do partake in, because we get to see heart every day. Because I'm not sure if my attitude would be different if I wasn't in this industry, because I do see, you know, a lot of disheartening things going on where people are choosing that, you know, their freedom or their point of view is more important than someone else's life at the end of the day. And that's kind of disheartening in a lot of ways, but I am glad I get to see our caregivers that strive to go out, everybody's caregivers, anybody that does this industry, any caregiver that does it, they go out every day to try to make sure their seniors are taken care of, and I commend them for that. And we just try to do it in a safe manner and keep, you know, our caregivers and our clients safe as we can. It's just, it's tough with all the innuendos that you hear from the state, the statistics, the naysayers, or the over-the-toppers the other way that, you know, it's coming.
Yeah.
My only issue is we go through flu season every year. We get it. It's one of the things we have to manage too. You know, we have flu shots that come on site with it. That's my only concern, because I know what a normal flu season looks like for us as an industry and a company, and it tends to be one of the tougher challenges that we face, simply because, you know, it's as good as the flu shot that year or the vaccine that year that comes out. If not, we have you know, it runs its course. That's the only thing that concerns me coming this year is
That's right.
Will we emerge between the two? And I know there's a bunch of opinions that out there. I'm going off of what my personal experience is with our company and our, you know, 200 plus caregivers, 400 clients, what we see. And I know what we see. Any other things added on top of that, you know, it adds just to another stressful point of the year for us.
No, there's. I agree with that totally, and I know people that, you know, are, for all intents and purposes, they're quite intelligent people, and yet, come on, it's just like the flu. It's no worse. Why are people acting like this? And sometimes it's hard not to grab these people and go, "Are you kidding me?" And then, of course, they come back with, well, all the percentages are being skewed. You know, hospitals get more money. You know, you hear this all the time. Hospitals get more money if they, you know, put down that somebody died from COVID. I don't have doctors agreeing with that.
No, I'm not sure if that is an internet conspiracy or if it's truth, or, I mean, first and foremost, if the truth is, then the federal government is giving money to hospitals for every COVID death. It just skews my opinion even more of our legislatures out there, if that's the case. But I hope not. But it is one of those things that we have to, you know, shift through to figure out what's truth and what not. Yeah, the bottom line is there's something out there that affects all of us in some way. And I can promise you, the one caregiver that we had, she really didn't have a pre-existing condition. She didn't have underlying. This just debilitated her all the way to the point of having to go on a ventilator. And ultimately, you know, her lungs couldn't take that. And, you know, she ended up, you know, having no brain function after that. So it left with no alternative except to do the inevitable. So I look, go, you know, from my own personal experience and what we saw, it doesn't matter. And I think that's what, you know, when I get into these heated discussions with folks, it doesn't matter. Again, if it only affects you mildly, or it kills somebody else, what's the difference? It doesn't matter how it affects or doesn't affect. It affects. It doesn't matter. So just have common courtesy for your fellow man, and in my case, our clients and our caregivers and everyone else, and just, be courteous, and wear a mask if you can. If you can't, social distance, respect my bubble,
respect my space.
My son has hula hoops just so he can teach boundaries. Respect my hula hoop.
Yeah, that's right. No, I'm like you. I'm all for liberty. I'd have no problem if there was a national or state mask law. Other countries have done that, and it has lowered the curve. It has lowered the cases. I don't get why we don't. I really don't. I'm not doing the ship it stuff from Publix anymore. I go into Publix. I do my shopping. Everyone has a mask on. I'd say for the last 8 or 9 weeks, since the cases skyrocketed. But before that, if I walked in and saw a few people without a mask, I walked out and called Ship It and had them deliver it. I sometimes you have to give up a little liberty to have a little respect for the person next to you. And I have no problem with that. And I guess, I don't remember who said it, but, in the worst of times, the best in people come out and the worst in people come out. And we're seeing a lot of best. That I love. We really are. But we're also seeing some things that we just shouldn't be seeing in this great country. But that's life, and life goes on.
I agree with you. And it's unfortunate that we do. And, listen, we've been, we're in healthcare. Wearing a mask is part of it. I don't get the whole issue, with the mask. That's my personal. I respect it, other people's opinions. I don't, try to judge or say anything to them. But if masks weren't, I gotta go back to just the basic essence. If masks weren't beneficial, then why does a surgeon have to wear a mask when they're operating
exactly.
on it? So if that's not a big deal, then what? Let them go in and just a la gratin, no mask, no gloves. What the heck? But I look at it and go, we're in healthcare. There's provenness that sanitary conditions and sanitary things, your gloves, your masks, the tools that our surgeons use on us, they all need to be sanitary for a reason. So I don't understand these things. I do think it's just an inconvenience for a lot of folks, and I don't have a tolerance for it. I get it. It's an inconvenience, but it's an inconvenience for all of us. It is what it is. I would like to see my kids grow up. I know you would probably like to see grandchildren, if around the corner. I think everybody needs to live life to its fullest because we only get one shot at it, at least this one. So I think we all should have a fair shake at it versus, being cut short because of
a selfish bastard.
Mm-hmm.
Yeah. I see it as an inconvenience. I do not see it as affecting my liberties, having to put on a mask. I don't see it. And then, we're going to have a couple of guests on in the next few weeks. There's two very big variables here. One of our guests calls it, I think more than he calls it, the great mystery is the people that survived, and they survived well. Everything's okay. I got it, had that burning feeling. I had my temperature. I had a lot of people that I know. Fortunately, I'm not one of them because my lungs are most certainly compromised. But be that as it may, there is this question mark, I'm being told by our great guests in the medical community, is what effect do the survivors have on their lungs and their heart in their 30s, in their 40s, that may not come out till their 60s and 70s? That I don't think anybody can even try to form a statistic on that.
No, well, I think that's kind of, that's trying to be a crystal ball of what this is something that clearly makes us sick. It's just like the flu, but the flu's been, if it was easy the flu would be eradicated in my mind. But every year they shoot for, I think every year they try to go 50%, coverage on the flu with the vaccine. But the last few years it's been like, you're lucky if you get 21 out of 4 coverage. So you still got a better chance of getting it than a chance of not getting or limited getting it. So, it's kind of hard for me just as a common sense thing to think through something of this magnitude wouldn't have long-term effects, because the flu and getting that has long-term, I won't say long-term effects, but it has effects on you. So I can't see something like this that attacks the body so violently in particular individuals would just magically go away. It boggles my mind. I'm not a medical professional, not pretending to be, just common sense. I think that sometimes eludes the conversation, regard the whole, even with directly with COVID and us, it's keeping the hysteria down with this. When me and people come to it and it's like, do we send somebody, this is what happened, 3 people removed, had it, tested positive, do they need to quarantine? And it's like, it's just calm down and, here's the common sense rules down the pike, and just keep it concise, keep it simple. And if this, then we do this. If that's not the case, then do this. And if that's not the case, they go to work. We have to be common sensed about it. If not, the mass hysteria gets it. And trust me, my office has been mass hysteria at times, with, someone tested positive over here and they came in contact with them for like a minute or 2, or they might have been in contact with them. Should they self-quarantine? And it's like, calm down. Let's just go through, tell me the scenario. Let's look at the rule book as best we know what it is today and make a decision going forward with it. Let the family know, let the caregiver know, we make a decision. Minimum, full PPE gear at a minimum, come in, get tested. And we do testing. I mean, just to throw that out there, we do, we have a testing program. It's a limited right now for certain caregivers that go into certain places.
That's great.
There's a chance the state is considering mandatory testing for all healthcare, that come in community-based healthcare, meaning us and others that go to the home or go to a community. So right now they have, if you live in an assisted living facility or a nursing home, anyone that comes in healthcare related, including our group, has to be tested every 2 weeks. Mm-hmm. So they're moving that possibly to include anybody that comes in contact with the vulnerable population. I take that as kids and seniors as well.
Yeah. It's hard not for the public to overreact, and this could be a show in itself, when no matter what station you turned on, no matter what side of the political aisle you're on, left or right, it's panic. If it's on the left, we're all going to die, and maybe we need to turn down shut down the country again, and the hell with the mask, we should be in hazmat suits. And if it's too far on the right, it's just like the flu, we're overreacting, and both of them are as moronic as the other. So no matter what station you put on, the average person looking for information is getting that, I don't know if there's a station, I happen to, I think I told you this the last time you were on, and that was months ago. I've stopped watching all cable news. All cable news. I get my information from certain websites that I feel are logical. I've been fortunate enough because of this show to have great connections with people like yourself, some incredible doctors, the Weizmann Institute in Israel. I listen to them because if I turn on Fox News, I'm going to hear it's been over-blemished. It's a hoax. It's just trying to get Trump not to be president. And if I turn on CNN, or not that I would ever turn on MSNBC, I think I've had it removed from my TV because just by accident, if I possibly get brain damage and turn on that station. But if I turn on CNN, which has got some good people, to hear another perspective, then we're not protecting ourselves and life's going to end soon. I mean, if the sun doesn't explode, and kill us, then the icebergs will kill us. And if not, coronavirus will kill us. How can the average person not be panicked when that's all they're force fed from whatever they turn on TV?
You know, I'm an equal opportunity offender, so I listen and suffer through all of those, even those ones that you don't even have on your dial. And I try
you listen to that one. That surprises me.
And I pick and choose. No, I listen. I listen to. There's only certain people I can't truly stand on some of those shows.
Yeah, me too. Me too.
And I'll say most all of them are primetime folks I can't stand. There's a few on primetime I can stand, but most of those I rotate around the people that I think are most newsworthy. But absolutely, listen, I'm not going to call names, but there's people on Fox that had shows that were, great. I think they shot straight. Same thing with CNN, same thing with MSNBC, BBC, C-SPAN. I'm an equal opportunity offender because truly the only way to get different perspectives is to seek out different perspectives. Because if you are looking just to have your perspective fulfilled, sure,
that can't be right.
Stay in your corner.
Yeah, I do like
Fox
BBC.
Guy, you're a CNN guy, you're an MSNBC guy. You're going to get your fill of your corner.
Yeah, but I have more trust in BBC right now than I do any American stations. They seem to give a better outside perspective. I happen to like NPR, but I read it on my phone or on my laptop. I literally have not watched a cable news program. Oh, it's got to be 2 years. This is not COVID-19 related. I mean, I'm just getting old. I'm getting cranky. I remember Walter Cronkite. I remember real news people. They didn't give their opinion. They reported the news. And I can't say that, I can say every news station that we have available right now to us has an agenda. They might as well just call it reality TV. Do they report some news every now and then by accident? But it's got to end with their corporate owners' agenda of what they feel the world's going to be. And there's an example or an exception, I should say, every now and then, but they'll get fired from any of those stations. To me, they all have agendas now. I mean, bring back, Walter Cronkite and David Brinkley. I'm getting old, aren't I?
No, you definitely have officially aged yourself there.
Yeah, I know.
Mike.
Well, even look at late night TV, which I don't watch. I'd rather watch a repeat of NCIS. I mean, you compared some of these people, that are at 11:30 at night, and they're young and they're brilliant comedians. You got to give them that. But compared to Johnny Carson,
they're entertainers. People drive the news cycle. I look at it as for us, I need to see things. And you're right. I search out, other alternative news sources because, I am looking for things that affect our industry, things that are affecting our workforce, things that might affect our clientele. Those are the things I'm trying to stay ahead of and be aware of. Legislation that's going to pass, things of that nature. And it is for people like myself that are trying to stay ahead of the curve when it comes to, legislation or newsworthiness for, my caregivers or my clientele. It is tough that you have to go search for that in the mainstream media. They're right there, but you actually have to search for those stories versus them,
Isn't that amazing?
Coming to you in what I would consider a normal, way. But now everything is such a hyperactive news cycle with it. And that's even with our folks. I mean, you talk about, our industry, not to, we off on a tangent, but it really isn't a tangent because a lot of the hypersensitivity to COVID, we see it, in our world because we have most of our seniors are over the age of 65. So all of our clients fall in the category of you're the bad category, to get it. You don't want to get it, and then, our caregivers, ours aren't too bad. Our median age is in the late 40s, so it's not too bad. but we do have millennia that work for us, and we have Gen Xers, Gen Yers, things of that nature. People in all generations, so they worry that they're going to be working in nursing homes or other people's homes and come to their home. So I do. We do see the mass hysteria entering our world, and it is served up by just the hypersensitivity to this subject. And that's when I get quite frustrated, because it's just, I got to get everybody back down to just, let's take some common sense approach.
Yeah.
We have a business to run. You need income. Care. The clients need care. We just need to come together with a common sense approach, because we just need to be cautious on all parts. And a lot of our care, we can be cautious. Other parts, we need to go above and beyond. Sometimes, if you have to give someone a shower, you have to get in close contact, great. Have another set of clothes, have another set of PPE gear. Do what you have to do, get out, change, come back, and then back to social distancing. There's try to be as safe as you can, but with the mass hysteria that does go on, the world is falling on one side and there's nothing wrong on the other side. Yeah. The reality is in between, is that we have to deal with it. So, it's tough. It's tough managing, my little world in healthcare, let alone what my colleagues in a nursing home or an ALF is doing, or, a COVID unit, that I have friends that are nurses on. Yes, I'm lucky that I have my little world, and it's crazy. I can only imagine what their worlds are like.
Exactly. Well, I'm going to ask you a question now, and I know you have to answer to a degree as a healthcare person because of what you do for a living. But I am asking you more grandfather to father. I have had some great medical people that I know personally who have school-age children. These are friends, personal doctors, associates. None of them are sending their children back to school. None of them. And I'd say I could, in my little world, probably talking 8 or 10 friends that are either physician assistants, registered nurses, doctors. Several of them have said to me, Michael, make no mistake about it, opening up the schools is nothing but a big social experiment. We're going to see what happens. What do you think about schools opening up?
My personal opinion, not represent, just Colin Castle's opinion, is it's tough. I'm not going to. I'll be very forthright. My wife and I are lucky that we send our kids to private school with it, that have the capabilities to institute some good precautions and parameters. But also have my best friend advocates for reading literacy inside of Pinellas County schools at a very high level, because him and I, our friend group, grew up in Pinellas County, and we know the differences between education gaps between social economic places in Pinellas County. And my buddy advocates for reading. He's an avid reader, and he believes that's a path out of some of the areas that our folks grow up in and live in. Absolutely. And the sad though is I don't believe our school systems, our public school systems, are built and capable of doing this at a level they should. It's not their fault. They're only working with the tools that they have and availability that they have. So if people do go back to school, I am expecting, there's going to be some ramifications to it. But my overall opinion is, if they cannot do it safely, if they cannot do it to the best of their ability, then they shouldn't do it at all. And kids are going to be kids. So if you have to factor in that kids are going to be kids, and by definition, they're not going to follow the rules. I didn't. I'm pretty sure you didn't. I'm pretty sure, some kids aren't going to do it. That's just the nature of the beast. Not all kids are bad. Not all kids are going to, not listen, but they have to factor that in. And if they're not factoring that in, then it is to your point, a social experiment. They may get lucky, and hey, Pinellas County in Florida, if you look at Pinellas County, our infection rate is very low compared to other areas. Why? I don't know. I have no earthly clue why, but for some reason we are. But if you look in other areas, even less populated areas, they have a much higher, at least according to the data, they have a much higher, positivity rate with it. So I just look at it and go, I'm not sure I would open up schools or not. It's a highly volatile conversation. Mine would be just on the simple fact of, can I do it safely? And if I couldn't do it safely as a superintendent, I'm not sure I could look at my staff, or I look at it no different than me. If I can't send my caregivers into a home or facility and keep them safe, as I have a duty to do with it, then how can I send them in there? I can't. I shouldn't. I look at this the same way. I have teachers. I shouldn't send my teachers into a situation that they're trained, ill-advised, no support potentially to handle the situation. So I don't envy anyone making those decisions. I sympathize with them, but I would just go off the fact that if they can't do it, don't do it.
And there's also economic concerns and certain people, and these are certain people on both sides of the aisle. You got to put life first. You got to put life first. You got to put health first. And that makes so much sense. And in your heart, you want to always do that. But what about the mom and dads that need to go to work, to pay rent, to put food on the table? You have to have the respect for those people to give them some options. And sometimes I forget, sometimes I think people forget that's the bulk of our country. Mom and dad going to work, and if they're lucky enough to still have a job, after these last 5 months, they may not be able to sit home with the kids, and quite frankly, they may not be able to afford childcare. There's a lot of the country like that, and we got to give those people an opportunity. I'm okay with opening the schools. I wouldn't send my children. I'm talking to some people that say they already know that the class is going to have 9 people. Like it has 22 people virtual, online, and 9 people in school. I'm okay with 9 people. They can sit 6 feet apart. But I'm talking to parents who are going, the school said there's 29 people in the class. Where's the social distancing? So I have a problem with that, but I think they have to try.
Well, they should do both. If you put me on the spot, I would absolutely open up both in class and virtual, and I would treat them equally and the same. But same thing with parents. If you go virtual, I'm treating your kid the same way as if the kid was in classroom. And if he doesn't do his homework, she doesn't do his homework, it's the same grade as the kid in there. So I am that type of want to have that type of consistency. But I do think they should open up both, because of the parents that can stay home and they want to stay home and they feel obligated to keep their kids safe. They should have every right to do so, just as the parents that really don't have a choice. They do have jobs.
That's right.
And trust me, I get that more than most. Most of our caregivers have families. They have kids that need to go to school so mom or dad can go to work. I get it, but they should have also that opportunity to choose their path as well. I don't agree with just one or all of both, because it does not fit. It's not a one-size-fits-all problem.
No, it definitely isn't. And I hope they're not stubborn about this, politics is in everything. But my God, I hope in the next 2-3 weeks, if the curve stays flat, if there's any positive whatsoever, we keep on. But if cases start to increase again, they better close those damn schools, because it's not going to be a coincidence. Even the conspiracy people, it's going to be rough.
Yep. I'm just glad I'm in an industry that leads with their heart versus a lot of other options. So my wife and I are quite lucky that a lot of our decisions are are driven by protecting our caregivers and giving our clients the best possible care they deserve, and our seniors help. So I'm glad I'm at least that's my driving forces versus other folks that have probably a tougher,
Yes.
perspective to process. Like a superintendent, I could parallel it, but it's not something I might want to, fill his or her shoes doing, because that's a tough call.
Yeah, and now even though bars are back to being closed, movie theaters are at 50% and showing movies from 2 years ago, but restaurants are open. How about all the people that have to get back behind the counter in the kitchen saying, "Can I help you?" That was a big part of my life when I was younger. These people have to go to work. I respect that. We got a little more than 30 seconds left. As always, such a pleasure to have you. We are going to have the better half on one day. I keep threatening that, but you don't let her come on. And I shouldn't say that. But I want to have the better half on, and I want to do a show soon with a couple of your caretakers. I really do, to get their perspective.
Let me know, and I'll make it happen.
One more with 10 seconds left. Your friend that is high up with the reading initiative, I would love to have him on the show if you think he'd enjoy that. 3 seconds left. I have wonderful guests in the next 2 weeks. Thank you so much, Colin. Thank you.